Hello, everyone. Welcome to our new featuring page section of the TBPPM Learning Network. We're very excited to share with you that we have started a new section here where we will be highlighting innovative projects and lessons learned from very many practices from our community members. It is a new platform to share your work with the rest of the community and also to learn from others involved in private sector engagement and tuberculosis care. So today with us, we have Dr. Mahesh, the District TB Officer in the Koppal district in Karnataka in southern India. And we're very, very pleased to hear the experiences of their work. He's going to talk to us about the Koppal district and the strategy that they have adopted there, a village adoption model, and it's engaging private practitioners. So without further from my side, because today our special guest will tell you everything. Good morning, Dr. Mahesh. Thank you so much for joining us.
Good morning. Good morning.
Yes,
Thank you.
Good evening for you. We are blending
definitely.
the world together. Could you give us a brief overview of the village adoption model and how it works?
Yeah, village adoption model is a part of community engagement plan. In that we have involved private practitioners to adopt the villages. First of all, we have invited all the private practitioners to take up this initiative. In that initiative, mainly we are addressing universal health care to underserved people in the community to minimize the gap of urban and village or rural side.
That sounds great. So as countries are moving forward towards universal health coverage and we are looking at the NTB strategies, can you outline to us a little bit why engaging the private sector in the TB village adoption model is crucial for the way forward?
Poor and vulnerable people, they're residing in the village or rural side, they're really spending a lot of money towards the health care in the private sector. And they're not approaching the public sector because of so many issues regarding accessibility, affordability, other things. So to minimize their out-of-pocket expenditure as a part of universal healthcare, I have adopted this model to serve the underprivileged or underserved community in the rural area. And the same thing that main intention is to minimize the gap of TB cascade of care, which is more in the rural sector because of so many issues regarding the healthcare facility in the rural sector.
That's interesting. So how many villages have been covered so far and what are the future plans for expansion?
So far we have adopted 25 villages in the small district of 16 lakh population. And in future days, we are having the target of 100 villages needs to be adopted by private practitioners. And same thing, we wanted to have one hospital consortium of private practitioners for TB elimination. That is our future plan to increase the ownership for the TB program by the private sector. This is our Koppal district strategy in future days.
Oh, those are ambitious targets. That's great to hear. So with COVID seeing rapidly increasing numbers these days around the world, but also in India, could you tell us how your program is impacted and what adaptation strategies you have put in place?
Yeah, this because of COVID-19, TB has affected like anything throughout the country or universe. But in Koppal, the TB program has affected a little bit. It's not significant. We have adopted some strategies to mitigate these effects. Like we have village community model to track the presumptive TB cases from the villages and all the urban sectors. And the same thing, we have adopted one transportation facility model of all these sputum samples from patient to diagnostic center. So both the things we have managed effectively so far, like identification of presumptive TB from the patient side in the community by community volunteers and other things by community engagement model in the public sector. And same thing, like again that transportation of the sputum was a problematic for all these days because of lockdown and the other issues. somehow we have managed with our staff and other things by transportation of sputums from community to diagnostic center. So far we have effectively managed, and till now for this one, our case notification rate has not been affected even 1 point also. And for your good thing, like so far our case notification rate is 204, like incident cases per 1 lakh population, and that is almost on par with the national estimated. It's more than the national estimated cases we have identified with this effect in spite of this COVID. So this is because of this one village adoption model and community engagement through identification of presumptive TB cases, through by village tracking of presumptive cases, and transportation of these specimens from village to diagnostic center by our health staff. That's the strategy we have done so far to mitigate this COVID effects. By this, somehow we could maintain this case notification, and we have minimized this TB cascade care uh, by these strategies.
Oh, that's really impressive to hear, and I think those are important lessons to share with other community members, because everyone is trying to see what way we can actually work and ensure that the TB services continue. So, thank you for those points. So, as a last question, can you just let us know what advice would you give other TBPPM community members with the experience and the lessons learned overall from your program?
Yeah, see this from village adoption model. I would like to learn some of the few things. Without the involvement of private sector, it is difficult to achieve universal health care. And with this private sector, we will definitely reduce that out-of-pocket expenditure of the community. That is very important. And with this model, we have almost principles of universal healthcare, like community participation, equity, universality, has been addressed by this village adoption model. And second point, I would like to tell you about this private sector engagement is a vital, very crucial, with a multi-pronged approach. Is very essential in this, especially in this hour. And last thing I would like to convey the message is the local innovative strategies to improve the private sector is utmost important to increase the TB program performance, as well as to decrease the gap of TB sorry, uh, to increase the performance, as well as to increase the TB care cascade effectiveness with this private sector involvement. That's what my this one. Shortly, I would like to say that private sector involvement is most important, with multi-pronged approach to increase the universal health coverage to eliminate TB from the globally.
Yes, thank you. I think you did a beautiful summary there in the end. Really appreciate it. For everyone who's listening in, you will be able to find the story and all the experiences from Koppal on our site. We have written up, and this feature story will be available for everyone to look up and learn more from Dr. Mahesh's story. Thank you, Dr. Mahesh, and your team. This
Thank
was
you.
wonderful to have you as our first feature story. We're very pleased to hear your lessons, and thank you for taking the time sharing that with us today.
Thank you, madam. Thank you. Thanks a lot for your kind support and enthusiasm to show our Koppal performance, to showcase to others also, and to share the class learning.
Yes, absolutely. And be ready. There might be questions from other community members that want to hear more from your experiences. Thank you so much for showing us the way forward, and we wish you a pleasant rest of the evening. Until next time.